I was at the close of my shift when a 5 days old baby was brought to the neonatal unit by the outpatient nurse. And it happened that on receiving this baby, I noticed the baby was yellow, the skin was yellow, very yellow, the eyes was yellow, even down to the tongue was yellowish. The cry also was so weak, and for the lack of a better word, I would say this baby was unconscious. Hi my amazing parents, welcome back to the channel where we talk about everything babies. And on today's topic, we'll be talking about something that almost each and every one of us have heard of, but it's still something that can be very scary when we see it in our newborn. And it's also sad that some of my new parents can still not identify these signs when they see it in their newborn. Sometimes last month, I was at the close of my shift when a 5 days old baby was brought to the neonatal unit by the outpatient nurse. On receiving this baby, I noticed the baby was yellow, the skin was yellow, very yellow, the eyes was yellow, even down to the tongue was yellowish. The cry also was so weak, and for the lack of a better word, I would say this baby was unconscious. So fast forward to the following day after admission, we lost the baby. The jaundice had already affected the brain, and there was really nothing much we could do. It was a very sad one for me because if it was identified early and treated promptly, the baby would still be here with us. So what is jaundice? Jaundice is when a baby's skin, the tongue, and even the eyes are yellow because of too much of a substance called bilirubin in their bloodstream. So you might be wondering, what is this bilirubin? Bilirubin is like a yellow paint left behind when your body breaks down red blood cells. So normally the liver is supposed to clean this up, but in newborn, their liver is still learning the job. The liver is not so matured enough to do the proper cleaning, and this makes the bilirubin to build up in their bloodstream. Jaundice is very common in babies. In fact, it happens to almost all newborn in their first week of life. This happens because their body is still adjusting to the life outside the womb. And in some cases, it can be as a result of infection, liver problem, or even difference in blood group. So what are the signs to look out for when you're checking for jaundice? Number one is yellow skin. Generally, it is easier to notice this jaundice on a light-skinned baby, but in dark babies, you can check the white part of their eyes to see if it's yellow in color. You can check under their tongue. You can also find out if your dark-skinned baby has jaundice by gently pressing the skin on their forehead, the sole of their feet, and if you see any yellow tint, it is a sign of jaundice. Other signs to look out for is when your baby is not feeding well. You also notice that your baby sleeps more than usual, or even starts sleeping immediately you initiate breastfeeding. You can also notice that your baby is not gaining weight. All these are early signs of jaundice, and when you notice these signs, please, it is best to seek the attention of your healthcare professional. It is also important to ensure your healthcare professional checks your baby for jaundice by collecting their blood sample before they discharge you home. Sometimes indoor light and bulb can even trick you. It can prevent you from noting these signs. So make sure you check your baby's skin under natural light at least every morning for the first week of life. Jaundice, when detected early, is not something to be worried about. Most babies do just fine after phototherapy. Phototherapy is a special blue light that helps to break down this bilirubin in your baby's body. So as a new parent, ensure to check your baby daily under natural light. Keep up with your breastfeeding. I always encourage exclusive breastfeeding, and also keep up with your doctor's appointment. This way they will be able to pick any signs as early as possible and offer you the best treatment possible.